Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today we are discuss about hospital chapter, subject hospital and clinical pharmacy, class D pharmacy second year. So friends, I request you to all watch this video till the end. Let's begin. Topics covered under this video. Following topics we are discuss about in this video, which are as follows: definition of hospital, functions of hospital, classification of hospital, services of hospital, medical staff of hospital, management of hospital, and health delivery system in India. These topics we are discuss about in this video. Let's start. First point: definition of hospital. What is the definition of hospital? Which follows: hospital is an organization or establishment where medical or surgical care and treatment is provided to the ill or injured patient by the team of trained staff using specialized scientific equipment. These are the simple definition of hospital. Next point: functions of hospital, which are as follows. There are main six functions of hospital. First one: patient care. The main function of hospital is to provide care to the ill and injured patient and restore the health of patient. Second main function: medical research. Hospital plays important roles in medical research. It helps in developing new methods of treatment. Some common areas of research are development of new techniques in surgery, diagnostic procedure, etc. Next, third point: public health. Hospitals should support all the activities carried out by various public health and voluntary agencies like blood donation camp, immunization program, health checkup, etc. Fourth function: training. The hospital should organize the training program for the nurses, physicians, lab technicians. The training program should arrange periodically under the supervision of experienced person. Fifth one: education. A hospital can be considered as a workshop where students learn by observation under the guidance of superior staff. Sixth main function: education to patient. The important function of hospital is to provide education to the patient related to any disease, hygiene, diet, etc. These are the main six functions of hospital. Next point: classification of hospital. There are main three types. Hospital mainly classified into main three types, which are as follows: A, on clinical basis; second, on non-clinical basis; C, miscellaneous. In classification, on clinical basis and on non-clinical basis, these are main types. Let's first on clinical basis, which are also divided into four types. First one is on the basis of major diseases. Example: TB hospital, cancer hospital, leprosy hospital, mental hospital. On the basis of major diseases. Second, on the basis of client group. Example: pediatric hospital for children, maternity hospital for mother, gynecological hospital for women. Third one, on the basis of anatomical and physiological specialization. Example: ENT hospital, orthopedic hospital, kidney hospital. D, on the basis of system of medicine. Example: allopathic hospital, Ayurvedic hospital, homeopathic hospital, and physiotherapy hospital. These are the four types of. These are the four types under the on clinical basis. B, B means second main types on non-clinical basis, which are also divided into main five types, which are: first one, on the basis of ownership, on the basis of bed size, on the basis of length of stay, on the basis of cost, on the basis of cost, and fifth one, on the basis of accreditation. Let's start one by one detail. On the basis of ownership, which are also divided into two types. First, government hospital, and second, non-government hospital. In government hospital, there are also three types. First one, central government. Example: central government health sham hospital. State government. Example: primary health center or civil hospital. Third one, under the government hospital. Example: military hospital. Second subtypes of on the basis of on the basis of ownership is non-government hospital. Example, private hospital. Example of hospital, Just Look Hospital, Mumbai. Second main subtypes under the on non-clinical basis, on the basis of bed size, which are divided into four subtypes. First one, large hospital, means bed size is 1000 or more. Example, JJ Hospital, Mumbai. Second, medium hospital, bed size is 500 to 1000. Example, Just Look Hospital, Mumbai. C. Small hospital, bed size is in between 100 to 500. Example, Hinduja Hospital, Mumbai. D. Very small hospital, bed size is less than 100 bed. Example, private hospital. These four types of hospital under the on the basis of bed size. C. Third main types under the on non-clinical basis, which are also divided into two subtypes. First one, short stay, and second, long stay. In short stay, the patient stays in hospital for less than 30 days, and in long stay, the patient stays in hospital for more than 30 days. Next subtypes, on the basis of cost, which are also divided into two types. First one, elite hospital, and second, budget hospital. In elite hospital, these hospitals are like the five-star hotels. The hospitalization rate of these hospitals may be up to 12,000 to 15,000 per day. The rooms are equipped with fridge, TV, AC, telephone, etc. facilities. These hospitals are known as five-star hospital. Example of elite hospital is Hinduja Hospital, Just Look Hospital, Lilavati Hospital, Mumbai. B. Budget hospital. The hospitals are used by low and moderate budget uses. Example, KM Hospital, Mumbai, Civil Hospital, etc. Fifth subtypes on under the on non-clinical basis is on the basis of accreditation. A. Accredited hospital. B. On non-accredited hospital. In accredited hospital, they meets to the specified standards of the healthcare. On non-accredited hospital, these hospitals does not completely meets to the specified standards of healthcare. These are the five subtypes under the on non-clinical basis. We see again on the basis of ownership, on the basis of bed size, on the basis of length of stay, on the basis of cost, and on the basis of accreditation. C. Subtypes under the hospital is miscellaneous, means example, teaching hospital. Hospitals can be act as a teaching hospital to which a medical college is attached. Example, Sasun Hospital, Pune is attached to the BJ Medical College, Pune. Clinic. What is definition of clinic? A clinic is an establishment where only outpatient visits and they does not have any facility from admitting the patient. These are the simple definitions of clinic. Next main types of the chapter is services of hospital. Hospital is a complex organization which deals with different type of services. There are two main types. First, clinical services and supportive services. In clinical services, there are six subtypes. First, pediatric services. Second, gynecological services. Third, ophthalmological services. Fourth, ENT services. ENT means ear, nose, throat services. Fifth, osteology services. Sixth, psychiatric services. And B, services of hospital. Supportive service. These are the supportive services. Under the supportive services, which are also seven types. First one, nursing services. Second, radiology services. Third, pathology services. Fourth, dietary services. Fifth, pharmacy services. Sixth, anesthesia service. Seven, medical record services. Let's see one by one in detail. Nursing services. Nurses plays important role in hospital. They provides healthcare, teaching, counseling, and emotional support to the patient. Nursing persons should provide dignity and rights to every patient, regardless of color, caste, and status. Nursing services are under the control of nursing director. These are the nursing services. Second subtypes, radiology services. What is radiology? This department is under the supervision of specially trained, qualifying, and experienced physician of radiology. This department is necessary for diagnostic purposes. This department provides the services like X-ray, sonography, MRI, CT scanning, etc. Third subtypes, pathology services. This department analyzes the sample of blood, urine, sputum, feces, semen, etc. for presence of microorganisms and abnormal constituent. The head of pathology department should be professionally qualified and should have more experience. Fourth subtypes, dietary services. These services are provided in the hospital under the guidance of qualified dietitian. This person applies principles of nutrition and also maintains records of patient regarding food allergies. These are dietary services. Fifth one, pharmacy services. These services are provided by hospital under the guidance of pharmacist, well-trained pharmacist. The pharmacist must be professionally qualified and should have adequate knowledge of drug. He should be able to dispense the drug to both in inpatient and outpatient. Sixth service of hospital is anesthesia services. These services are provided by the professionally qualified trained person. These services are required for the patient who will undergo surgical operation. A proper anesthetic agent should be selected having rapid induction and recovery of anesthesia. And second last services of hospital is medical record service. Medical record keeping is considered as a boring job, but it is very important for both patients and hospital. This department deals with maintenance of records of clinical information of patient, which can be supplied to the physician whenever required. Uh, next, next main types of this chapter, medical staff of hospital. Every hospital should have competent and legally qualified medical staff, and they should be available for medical care of patient. They are following type. They are following types of medical staff of hospital, which are also divided into six types. First, honorary staff. Second, consulting staff. Third, associate staff. Fourth, active staff. Fifth, courtesy staff. And last one is residential staff. Let's see one by one in detail. Honorary staff. What is honorary staff? These staff members are retired person, but they provide their services in the hospital because of their vast experience, deep knowledge, and outstanding work. They may act as a part-time medical profession. These are honorary staff. Second, consulting staff. What is consulting staff? These staff members consist of medical practitioner having professional ability. They generally works on OPD basis. Generally, this staff member includes specialists from different branches. Third one, associative staff. This staff member consists of group of juniors or less experienced member. They works in the hospital for purpose of practice or training. Fourth, active staff. These staff members are directly involved in the hospital. They actively participated in the patient care. Fifth, courtesy staff. It is a group of staff members who have permission for attending their own private patient in the hospital. They does not get involved in the treatment of other patients of hospital. Sixth one, residential staff. These staff members are available in the hospital of 24-hour basis services. That is, they work in hospital and stay in hospital campus. Management of hospital. Last main types under cover this chapter. Management of hospital. The hospital should be managed by the administrator of hospital. The dean or director is an administrator of hospital. The administrator should have following responsibility, which are as follows. He should select appropriate staff. He should control hospital funds. He should form various committees for different functions. He should design working hour, salary, schedule, etc. for the staff working in hospital. He should coordinate all the department of hospital. We see once again. from start. Medical staff of hospital, services of hospital. There are 6 services cover under the chapter. 7 services, sorry. Let's see once again from start. First one, definition of hospital. Second, functions of hospital. There are 6 functions of hospital. One, patient care. Second, medical research. Third, public health. Fourth, training. Fifth, education. Sixth, education to patient. Classification of hospital. There are under the three main types: on a clinical basis, on non-clinical basis, and miscellaneous. On clinical basis, there are 4 subtypes: on the basis of major disease, on the basis of client group, on the basis of anatomical and physiological specialization, on the basis of system of medicine. On non-clinical basis, there are subtypes: on the basis of ownership. There are also subdivided into 2 types: government hospital and non-government hospital. Second, on the basis of bed size, there are also 4 subtypes: large hospital, medium hospital, small hospital, and very small hospital. Third subtypes, on the basis of length of stay. There are 2 subtypes: short stay and long stay. Fourth main types, on the basis of cost. There are also divided into 2 types: elite hospital and budget hospital. On the basis of accreditation, accredited hospital and non-accredited hospital. And last one, miscellaneous, means teaching hospital, in which medical college and hospitals are connected to each other. Definition of clinic. Services of hospital. There are 2 main types of services of hospital: clinical services and supportive services. In clinical services, there are 6 subtypes: pediatric services, gynecological services, ophthalmological services, ENT services, osteology services, psychiatric services, etc. And in supportive services, nursing services, radiology services, pathology, dietary services, pharmacy services, anesthesia services, medical record services, nursing services, radiology services, pathology, dietary, pharmacy, anesthesia, medical record services. Medical staff of hospital. There are 6 type of staffs present in the hospital. First one, honorary. Second one, consulting staff. Third one, associate staff. Fourth, active staff. Fifth, courtesy staff. And sixth, residential staff. These are the staff present under the medical staff of hospital. So friends, if you any doubt about this chapter, so ask me in comment section. And friends, if you are new on the channel, so please like, share, and subscribe to our YouTube channel for pharmacy related daily updates. Thank you, friends. We will meet again next chapter.